This lecture is about the stress response. By the end of this lecture, you should be able to name the 3 levels at which the stress response can be observed. You should be able to describe the physiological responses to stress. You should be able to explain the difference between the fast versus slow physiological pathways that respond to stress. You should be able to describe Selye's general adaptation syndrome and provide some criticisms of that syndrome. The stress response can be observed at 3 levels: the emotional level, the physiological level, and the behavioral level. Given a potentially stressful objective event such as a major exam, a big date, trouble with one's boss, or a financial setback, one undergoes cognitive appraisal of the stressor. So one's personalized perceptions of threat are influenced by the familiarity with the particular event, the controllability of the event, and the predictability of the event. Given that appraisal, one will experience 3 different sorts of responses. One will experience an emotional response to the stressor, such as annoyance, anger, anxiety, fear, dejection, or grief. One will experience a physiological response to the stressor, such as autonomic arousal, hormonal fluctuations, and neurochemical changes. And one will experience a behavioral response to the stressor, such as coping effects, including lashing out at others, blaming oneself, seeking help, solving problems, and releasing emotions. In terms of the physiological response to stress, Hans Selye was the first to describe the stress response in the 1950s. He pointed out that in the short term, the stress response produces adaptive changes that help the animal respond to the stressor. So, for example, given a particular stressor, you would see increased cholesterol and fatty acids in the blood for energy production systems. You would see decreased protein synthesis, intestinal movement, immune and allergic response systems. You would see increased blood pressure. You would see increased metabolism, for example, a faster heart rate and faster respiration. You would see localized inflammation, such as redness, swelling, heat, and pain. You might see faster blood clotting. You might see increased production of blood sugar for energy, and you might see increased stomach acids. However, in the long term, the changes that Selye described can become maladaptive. Selye attributed the stress response to the activation of the anterior pituitary adrenal cortex system. So given a particular stressor which has an effect on the brain, that effect on the brain will translate to an effect on the anterior pituitary gland, which will have effects on the adrenal cortex, which will cause the release of glucocorticoids. Most modern theories of stress also acknowledge a major role for the sympathetic nervous system, specifically the adrenal medulla. So in addition to the effects on the anterior pituitary, the brain will also affect the sympathetic nervous system, which will have effects on the adrenal medulla, which will release norepinephrine and epinephrine. Still, the most commonly employed physiological measure of stress, if you're wanting to get a measure of stress in an individual by, for example, taking a blood sample, would be measuring their levels of circulating glucocorticoids. The anterior pituitary pathway is known as the slow pathway, whereas the sympathetic nervous system is known as the fast pathway. We'll talk about each of those in turn. The fast or immediate pathway is the sympathetic adrenal medullary pathway. In this pathway, the hypothalamus is stimulated by stress, physical activity, or low blood glucose levels. And that stimulation causes the generation of action potentials through the sympathetic division of the autonomic nervous system, which has an effect on the adrenal medulla, which causes the release of norepinephrine and epinephrine from the adrenal medulla, which has effects on various target tissues, such as increasing heart rate, increasing lung volume, increasing blood to muscles, and decreasing digestion. The slow pathway, also known as the delayed pathway, is the hypothalamic pituitary adrenal cortical pathway. In this pathway, the hypothalamus is stimulated, causing the release of corticotropin-releasing hormone, which has an effect on the anterior pituitary to cause the release of adrenocorticotropic hormone, which in turn has an effect on the adrenal cortex, which causes the release of glucocorticoids such as cortisol. Cortisol prevents inflammation, and the liver will also release glucose for energy in response to cortisol. There are 3 phases to Hans Selye's general adaptation syndrome. The first is the alarm phase, which is essentially a fight or flight response. The second is the resistance phase, And the third is the exhaustion phase. In terms of physiological responses, the magnitude of the stress response depends not only on the stressor and the individual, it also depends on what strategies the individual uses to cope with the stress. For example, a study by Katz et al. In 1997 of women waiting for surgery for possible breast cancer found that stress levels depended on how the women thought about their problem. For those who had convinced themselves they could not possibly have cancer, or that there was simply no point in worrying, they experienced a weaker stress response than those that had convinced themselves that they had cancer, for example. So in terms of the influence of Selye's general adaptation syndrome, it offers a general theory of reactions to a wide variety of stressors over time, and it suggests a physiological mechanism for the stress-illness relationship. That is, the relationship between stress and cardiovascular disease, stress and arthritis, and stress and hypertension, for example. However, there are criticisms of Selye's general adaptation syndrome. The first is that very little attention is actually paid to psychological factors in the general adaptation syndrome. The second is that general adaptation syndrome assumes that responses to stress are uniform. And the third criticism is that stress is evident only when the general adaptation syndrome has run its course, which is not necessarily true.